for every person who is to be a doctor. Okay, so as a doctor, you are supposed to generate prescriptions throughout your life, and you must be very careful on generation of prescription. So, what is a prescription? Definition of a prescription. A prescription is a written document by a registered medical practitioner containing one or more medicinal ingredient to the pharmacist for compounding and dispensation, and to the patient for the use of medicine. ঠিক আছে? Use. ঠিক আছে? ঠিক আছে? তাহলে first and foremost, it's a written document. It could be written by hand, or it could be a printed computer generated prescription like this, whichever it is convenient for the practitioner, by a registered medical practitioner. What do you mean by a registered medical practitioner? Registration number. ঠিক আছে? The practitioner must enroll himself into the medical council. Who can generate it? A doctor can generate it, who is registered. In our state, we have West Bengal Medical Council. You are from? You are from Ranchi. So in Jharkhand, there may be another council. So she can get registered in her own state. So whichever medical council it be, have to be registered. The dentist can generate prescription. Of course, they has to be registered. Ayurvedic physician can generate prescription. They have to be registered in their own council. Other medicine like homeopathy, Unani, they can also generate prescription. They have to be registered in their own councils. Okay. So generated by registered medical practitioner. Can you generate prescription? No. You have not got the registration number. ঠিক আছে? Containing one or more medicinal ingredient. What do you mean by medicinal ingredient? Drugs. So, because it's a subject of pharmacology, we will concentrate on drugs. But prescription not only contains drugs, it also contains the complaints, the diagnosis, some investigation, may also contain some procedure, may prescribe some procedure, some surgery. Okay. Some non-medical advice. Like say for example, a person having knee pain, he can be advised for lifestyle modification. Okay, for non-pharmacological remedy of disease, that can also be there in the prescription. Okay, so containing one or more medicinal ingredient, to whom it is instructed to both pharmacist and patient. First for the pharmacist. Now earlier it used to happen that the pharmacist used to make the prescription, make the drug in his pharmacy. He used to take the ingredient. Many in pharmaceutical shop you will see this picture of mortar and pestle. Have you seen this? Mortar and pestle. They used to put the drugs in there and mix it out as per the direction. So nowadays you get this pre-formulated medication, tablets, capsules, syrups. These are manufactured by the pharmaceutical company and readily available in the pharmacy shop. So the pharmacist no longer has to prepare this medication. That is known as compounding. Okay, and dispensation. Dispensations mean to give the medicine. Okay, you ask for some medicine, that is being given. And to the patient. So the patient is the end user. Patient is the end user. When you give a prescription, the pharmacist will give you the medicines and he will explain you how to have the medicine. So that is the definition of prescription. Now let's come to the parts of prescription. Now what comes from this chapter is earlier there used to be writing of prescription. Now what comes from this chapter is criticism of prescription. Okay, for you to criticize a prescription you must know what a good prescription looks like. কোনদিন এসছিস? দেখিনি, মনে করছে না। তোর বন্ধু গেল কত? হয়ে গেছে। এই কদিন আগে বাড়ি থেকে ঘুরে এলো আবার বাড়ি চলে গেল। আচ্ছা, let's come to parts of prescription. So prescription is either written in pre-printed stationaries. You have seen letterheads, নাম টাম দেওয়া থাকে. So pre-printed stationaries, or in hospitals there are outdoor tickets like this. Okay, so what are the parts of prescription? So first, name of the practitioner. Okay, then qualification, MBBS, MD, whatever be the qualification, that has to be there. Then registration number. So when you register yourself with the medical council, you get a registration number. Then address, where he or she is available. Then there is the contact number. If patient is having some difficulties, he may contact the doctor. If the pharmacist is having some difficulties, he or she may contact the doctor. Okay? This will be printed in the prescription. The pre-printed stationery, these will be printed. Then comes patient particular. এই মেডিসিন ওয়ার্ডে যাওয়া হয় কেন? হ্যাঁ, আচ্ছা, পেশেন্ট পার্টিকুলার মিনস নেম। ঠিক আছে, নেম, এজ. What is the significance of age? For pediatric dose. ঠিক আছে, different age groups may have different, in pediatric there will be doses. Suppose an elderly person may have some comorbidities. Okay, some kidney failure, some renal failure may be there. ঠিক আছে, sex, significance of sex, suppose a lady comes to you in the reproductive age group. So then you have, if you are prescribing some drug that is having teratogenic effect, you must be careful. Okay, what is teratogenicity? ঠিক আছে, ঠিক আছে. Some people weight and height are also taken. Weight, what is significance? Dose calculation. Certain medication needs dose calculation. For that we need the weight, and height we calculate the BMI. নাম শোনা হয়েছে? তুই কি করছিস? লিখছিস? বাহ, বল। ঠিক আছে, you have to calculate the BMI. Some also writes address, that's optional. Okay, vitals may be there. Then comes chief complaint. Chief complaint is what? The complaint the patient is coming to you for. জ্বর হয়েছে, সর্দি হয়েছে, whatever may be, headache, গ্যাস হয়েছে, যা হয়েছে, that is a chief complaint. For we are concentrating on the pharmacology part. Okay, in medicine there may be investigations, some investigation, X-ray, CT scan, some blood investigation, blood sugar, hemoglobin, TCDC, ESR, these may be there. But because we are in pharmacology department, we will concentrate only on the pharmacological part. ঠিক আছে? Then after investigation there is provisional diagnosis or final diagnosis, whatever may be there. ঠিক আছে? So then we come to the pharmacological part of it. We will concentrate only on pharmacological part in our class for our purpose. ঠিক আছে? So parts of prescription. Let's write a prescription. Dr. X, MBBS, MD, Pharma. ঠিক আছে? বোলপুর শান্তিনিকেতন মেডিকেল কলেজ। তাহলে then you have the phone number. Let's say 9876543210 phone number. ঠিক আছে? Registration number 12345. ঠিক আছে? So this is printed in the paper. Then we come, a chief complaint আর লিখছি না, we coming directly to the pharmacological part. A patient particular, let's say Mr. Y, 50 years, male, 70 kg, 1.7 meter. ঠিক আছে? Now we come to the parts of prescription. R scratch. In prescription you have seen this sign. Okay, student love to call it RX, but this thing is R scratch. Some old examiners don't want to call it RX. They love to call it R scratch. Yes. So this is derived from a Latin word recipe, meaning take thou. Really? So this form superscription. ठीक है जी? Superscription. Then we come to the inscription. This R scratch is the superscription. Then we come to the inscription. Inscription of the body, which contains the name of the drugs. So let's inscription. Inscription consists of basis or primary drug. Primary drug means the main drug which is going to cure the patient or to cure the symptoms. ठीक है जी? Then adjuvant. What do you mean by adjuvant? Well, adjuvant means adjuvant is the drug that is going to increase the efficacy of the primary drug. যেমন levodopa and carbidopa. Okay, carbidopa itself doesn't have any action, but when combined with levodopa, it enhances the action of levodopa. Amoxicillin, clavulanic acid. Clavulanic acid itself does not have much of an antibacterial action, but when combined with amoxicillin, it produces, it potentiates the action of amoxicillin. That is the adjuvant. Yes, then comes the corrigent. Corrigent or correction. So certain drug may have certain adverse effect. To counter the adverse effect, you may need to give certain drug. These are the corrigent or correction. It's clear? Then comes vehicle. Vehicle माने? Vehicle माने? गाड़ी. ठीक है जी? So what does this vehicle does? So take for example, this is a ceftriaxone injection. Okay, so it is here in the powder form. So these have to be dissolved in water of injection and then has to be given. So the water of injection becomes the vehicle. So another case, the metered dose inhaler, there are propellant which propels the active ingredient, pharmacological active ingredient. So these are vehicle. ঠিক আছে? এগুলো সব ইনস্ক্রিপশনে আসবে। ঠিক আছে? সুপারস্ক্রিপশন আছে মানে সাবস্ক্রিপশনও থাকবে। ঠিক আছে? সো সাবস্ক্রিপশন। Subscription is the instruction to the pharmacist. ঠিক আছে? আগে যেটা হতো, the pharmacist used to make the medicine. Nowadays the pharmacy consists of these factory made medications, so no longer it is required. So subscription are not there in many medication. Still it is there, but the important has diminished. Acha. Then come signa or signatura. Yes, what does signatura means? It means instruction to the patient. So patient ki instruction debe, how much drug to be taken, the dose, dosing interval, after how much time it has to be taken. Suppose thrice daily, you have to take it after 8 hours, or twice daily, you have to take it after 12 hours. Duration of drug, duration of therapy, 5 days, 10 days, 7 days, whatever the duration may be. Route of administration, oral, subcutaneous, whatever it may be. ठीक है? So, and time of intake and relationship with meal. If it has to be taken in empty stomach or it has to be taken at bedtime, that has to be signified in the signature. Now, the most important part of it, signature. Without signature, the prescription is not a valid prescription. Okay. So, signature and date. ठीक है जी? Signature and date. So that must be present in the prescription. Whenever you put your signature and date, the doctor become responsible for whatever is written in the prescription. Okay. If you have prescribed some wrong medication, this prescription will be a medico-legal document. The patient can go into the court and just produce the prescription that look, this doctor has mistreated me, and you can be sued. So be careful while writing prescription. So doctor's degree, phone number, these are present. Patient particular are also present. Superscription is present. Let's say a person is having diarrhea, mild diarrhea, and doctor want to prescribe ORS. Let it be an old prescription where the pharmacist have to make the drug. ठीक है? So sodium chloride 2.6 ग्राम. ठीक है? पोटेशियम chloride 1.5 gram. Trisodium citrate 2.9 gram. Glucose 13.5 gram. Mix and powder. Direction: dissolve in 1 liter of drinking water and consume within 24 hours. So this is an old format of prescription. So what is the superscription? R scratch. ठीक है? So this is the superscription. Then inscription. Where is the inscription? ठीक है? Subscription, mix and powder. So it's an old prescription where the pharmacist will measure these salts and they are going to mix and powder in the mortar and pestle. And signatura, 1 liter of drinking water and consume within 24 hours. ठीक है? So this was how older prescription look like. ORS আলাদা ক্লাস হবে, ঠিক আছে, আবার পড়ানো হবে। ঠিক আছে, আচ্ছা, things that has to be kept in mind during prescription writing. First and foremost, the prescription must be a legible prescription. Legible বলতে পড়া যায়। So many doctors, including me, have terrible handwriting. So patient or the pharmacist must be able to read the prescription. ঠিক আছে? One way is that the drug must be written in capital letters, block letters. Then when you write the drug, you must mention the formulation. Formulation means tablet, capsule, syrup, whatever it be, mention the formulation. Then what is the amount of drug in per unit, 500 gram, 200 gram, 150 gram, whatever be it. So you must mention the amount of drug in proper unit. Then signature, I have told you about the signature. ঠিক আছে? So let's write a prescription about duodenal ulcer. A patient is suffering from duodenal ulcer. So superscription is being written. So I am only writing about the pharmacological part. There may be non-pharmacological part, investigational part, or the non-pharmacological cure. I am only concerned about the pharmacological part. ঠিক আছে? এই হয়েছে, গ্যাস্ট্রিক আলসার হয়েছে, হয়ে আছে তো, ঠিক আছে? So duodenal ulcer. So let's prescribe pantoprazole. ঠিক আছে? So tablet. One thing keep in mind, do not use abbreviation. So abbreviation must be avoided, like tablet, like tab. So please avoid the abbreviation. Tablet, pantoprazole. ঠিক আছে? Some just write the amount, you can write that is good, or you can write each tablet contains 40 mg. ঠিক আছে? Pantoprazole in blocks. Dispense 42 such tablets. Direction: one tablet per day in empty stomach for 6 weeks. So আজ হচ্ছে 16/1/26 তাহলে this is the subscription direction to the pharmacist ঠিক আছে dispense 42 tablet signature 1 tablet per day in empty stomach ঠিক আছে so you write the duration is 6 weeks amount 1 tablet each tablet containing 40 mg okay so once daily that is being written and that will be in empty stomach finally you end up with signature and date ঠিক আছে so this may not be present dispense 42 tablets may not be present so subscription has lost its importance ঠিক আছে is stocking up this strip one strip of tablet and he is simply dispensing ঠিক আছে so this was a simple one let's come to more complicated one now there are certain standard abbreviation Latin abbreviation like OD BD TDS so these are all Latin abbreviation so patient may not be able to understand it OD means once daily it's what you are telling in Latin you also don't know no need let the patient also don't know omni die OD means omni die so no need to memorize these Latin words it's historically important patient also don't know leave it write it in simple way so that patient can understand the objective is to make patient understand ठीक है so let's go to something complex let's say a patient is suffering from fever his blood is showing presence of vivax plasmodium vivax okay the area in the plasmodium vivax in that area is chloroquine sensitive so write a prescription কে রে বুঝছিস সেনগুপ্ত আচ্ছা so tablet sorry tablet chloroquine phosphate (500 mg) both 500 and 250 mg are present I am prescribing 500 mg okay so I am not writing that full 500 mg that is also good acha dispense 5 such tablet prima queen I missed something. So this is direction to the pharmacist. Then we come to the direction to the patient. 2 tablets on 16/1/26, 2 tablets on 17/1/26, 1 tablet on 18/1/26 after dinner. ঠিক আছে, পুরোটা লিখে দিলে ভালো হয়, আমি আর লিখছি না। ট্যাবলেট প্রাইমাকুইন ফসফেট 15 mg। ঠিক আছে, dispense 14 such, 1 tablet once daily at bedtime. So chloroquine phosphate is the basis, ঠিক আছে, and primaquine is for the hypnozoids. The hypnozoids এই হয়েছে ক্লোরোকুইন, এই জানো ম্যালেরিয়া লাইফ সাইকেল হয়েছে মাইক্রোতে, হ্যাঁ হয়নি? আচ্ছা, সো Vivax remains in your liver as hypnozoids. So primaquine is for the hypnozoids. So here primaquine is the key adjuvant. ঠিক আছে, আচ্ছা, chloroquine phosphate is notorious for vomiting. তাহলে ট্যাবলেট domperidone 10 mg, dispense 10 such, 1 tablet thrice daily before meal. ঠিক আছে, domperidone is for anti-emesis. So what is domperidone? Corrigent. ঠিক আছে, it's correcting the ADR. বুঝলি? আচ্ছা, জায়গা নেই, now since the patient is suffering from fever, headache, ঠিক আছে, আরো কিছু দিয়ে দেওয়া যেতে পারতো, জায়গা নেই বলে আর বাড়াচ্ছি না। ঠিক আছে, বুঝলি? So finally you put your put your sign and date. Once you put your sign and date, it becomes a medico-legal document, and whatever is written in it, who is responsible? Doctor. ठीक है? So you write the name in block letter, better. When you write some medicine, it's better to write it in generic name. There are name nomenclature হয়নি এই হা করে বসে রয়েছিস nomenclature বল nomenclature কিরকম কত রকমের nomenclature হয় সেনগুপ্ত ওই এই বল বিদিপ্তা বল হ্যাঁ ব্র্যান্ড নেম কেমিক্যাল নেম ঠিক আছে nomenclature কিন্তু ওরালেও জিজ্ঞাসা করে কোশ্চেনও আসে nomenclature of drug সবাই হা করে তাকিয়ে রয়েছে কি ব্যাপার ঠিক আছে write it in capital letter so here subscription and signature for each drug it is given separately ঠিক আছে for the patient to follow it better ঠিক আছে প্রত্যেকটা তলায় তলায় দেওয়া হচ্ছে তাতে ফলো মানে পেশেন্টের অনেক সুবিধা হবে you can write it club it at once but it will become much clumsier ঠিক আছে তাহলে কি দিচ্ছি 5 ট্যাবলেট তাহলে 2 ট্যাবলেট on 16/1/26 আফটার ডিনার কখন খাবে কতটা খাবে সবকিছু বলে দেওয়া হচ্ছে 500 করে মানে 1 গ্রাম ঠিক আছে নেক্সট দিন আবার 500 করে 1 গ্রাম তারপরে থার্ড দিন হচ্ছে 500 ঠিক আছে so primaquine phosphate is the adjuvant তাহলে কি হচ্ছে 14 such 1 tablet once daily at bedtime for 2 weeks বলে গেছি 14 days তাহলে কটা খাবে 15 mg once daily for 14 days কত দিনের জন্য খাবে সবকিছু দেওয়া আছে ঠিক আছে কখন দেওয়া হবে at bedtime আচ্ছা domperidone into for 3 days কি হলো 10 mg dispense 10 such 1 tablet thrice daily before meal for 3 days ঠিক আছে so this is how you write a good prescription now what comes is the criticism of prescription first go for the format means this name of the doctor the degree registration number the contact number address whether these are present or not then go for patient particular ঠিক আছে then go for the superscription body subscription date signature first look at the format then there will be problem within the drug that is prescribed for that you have to know a little bit of pharmacology there may be drug interaction or there may be improper drug administered for improper condition তার জন্য ফার্মাকোলজি একটু জানতে হবে এখনো বোধহয় অতটা জেনে পারোনি অনেকটাই তো হয়ে গেছে কমটা তো হলো না হয়ে গেছে তো এখন কি চলছে সিএনএস অনেকটাই হয়ে গেছে ঠিক আছে আর নিড সাম মোর knowledge about the systemic pharmacology let's do another prescription let's say a person is suffering from hookworm infection let's not go complicated ascariasis পড়ানো হয়েছে পড়ানো হয়নি কি পড়ানো হয়েছে ঠিক আছে, রাউন্ডওয়ার্ম বোঝা যায়, কৃমি তো সবাই জানে, রাউন্ডওয়ার্ম ক্লাস 12-এ পড়েছিস তো, হ্যাঁ, রাউন্ডওয়ার্ম। সো tablet albendazole 400 mg, either you can write 400 mg or you write each tablet contain 400 mg, both are good, ঠিক আছে। dispense one such, ঠিক আছে। direction one tablet to be taken, stat, sign and date, ঠিক আছে। একটাই ট্যাবলেট, স্ট্যাট দেওয়া হচ্ছে, ওকে। Now let's say a patient is suffering from hypertension, ঠিক আছে। হ্যাঁ, হাইপারটেনশন পড়ানো হয়েছে, তো হয়নি, হয়েছে, ঠিক আছে। হাইপারটেনশন উইথ বিপি অফ 190/100, so prescribe a medication. So tablet amlodipine 5 mg, আমি এরকম 5 mg লিখছি, ডিটেলসে দিচ্ছি না। dispense 10 such, one tablet to be taken after breakfast once daily. Acha, because it is tablet, we are not mentioning orally. It is good if you can mention the term orally, ঠিক আছে। হ্যাঁ, লিখে দেওয়া যায় orally, ঠিক আছে। সো রুট অফ অ্যাডমিনিস্ট্রেশন কখন নেবে? আফটার ব্রেকফাস্ট, ওয়ান্স ডেইলি, ঠিক আছে। হ্যাঁ, আসছি। ট্যাবলেট tell me certain, (40 mg), one tablet to be taken after breakfast once daily orally. Acha, for medications like hypertensive medication, diabetic medication, they continue for lifelong, ঠিক আছে, dispense ten such, for that case তাহলে কি হবে, follow up after 10 days, ঠিক আছে, 10 দিনের জন্য মেডিসিন দিলাম, 10 দিন পরে আসবে, so his BP is 190/100, তাহলে we measure it again, see whether it is in control, whether some modification is needed for medication, you may need to increase the dose or decrease the dose, whatever be it. And most important part, signature and date. না বুঝলি, ঠিক আছে। So this is in short about prescription writing. So the thing that comes is criticism of prescription. Probably the next week is a holiday. After that week we will probably do that, criticism of prescription. So first you know the parts of prescription, how to prescribe, how to write a proper prescription. Okay, the name had to be written, dose has to be written, how it has to be taken, which route, okay, everything has to be mentioned. So and signature and date. This is how you write a prescription. First know the parts of prescription, how you have to write it, then we go to the criticism.